I'm on opiates. He's on hydrocodone, about 40 milligrams a day. He goes, I function better. I said, we need to really look into this. There's some basic things about opiate dependency: hydrocodone, oxycodone, codeine, morphine, fentanyl, addiction, kratom, 7-hydroxy, mitragynine, pseudoindoxal, meperidine. These are all opiates. And he is telling me that his addiction to hydrocodone makes him a better person. I was like, let's look at the big one. I said, psychologically, this has taken over your life. Your priority, your primary focus in life is to get high / prevent withdrawal. I'm not sure which is bigger. I said, look at what it's doing to your finances. You're consumed with spending your money on getting this drug, and you started out like 5 milligrams a day, where 6 months later you're at 40. Sometimes you're at 50 milligrams a day. I've had patients go up to 1,000 milligrams a day of oxycodone. I said, you're consumed with this, and you're rationalizing in your mind. You're in denial. I said, you do that much, but what's the reason you're always coming in early for your prescription to your pain management doctor? Well, I run out. Also, he was supplementing with kratom. I said, you're really not using 40, 50 milligrams a day of oxycodone. You're supplementing with kratom. He goes, yes. And I said, you're drinking on top of 2 when you run out. He goes, yes. And then I relay to him, you would go pick up your oxycodone and make sure you have your oxycodone before you did anything else. Is that right? He's like, basically true. Have you ever run out? Oh, no. And I said, do you notice your appearance is not as good as it used to be? And he acknowledged that. I said, what do you do on your days off? And he says, I sit around, scroll through social media and do oxycodone or hydrocodone. I said, had you thought that one of the big preoccupations in your thought is the importance of this drug and how you plan on when you take it? You're very methodical when you take it? Oh, of course, he says. I said, what about taking a week off? He goes, oh, I would never do that. I said, how's your sexual drive doing? Oh, not so good. I'm not really that interested in that anymore. Well, opiates lower his testosterone. So he's not really going out or dating women because he likes his opiate and his kratom, and that consumes him. And he's also, I said, just by the way, now that we're talking about the biological components, are you aware that this drug lowers your immune system? Well, no, I didn't know that, he says. I said, so you get colds more frequently? He said, well, that may be happening. I said, you notice your gut is having a problem? He goes, well, what do you mean? I said, constipation. Oh, he says, I have chronic constipation. Well, that damages the gut, changes what's going on in that gut, changes the bacteria in the gut, changes bowel movements, and definitely hurts the intestines, the rectum, and does damage. He acknowledged that. I said, if you took too much, it's damaging to your lungs, and you have respiratory depression and overdose. Have you ever taken too much? Oh, he said, I have some close calls some days where, my breathing got a little faint and I slowed down breathing. Oh, a lot of people, the way you die from opiates is through respiratory depression. You stop breathing. And of course, there's always the liver problem where you're metabolizing this drug in your liver and the metabolites stick around and you get cirrhosis, or a lot of people, it's very common to start shooting as their dose gets higher and higher, and they want that more potent high, and they wind up getting hepatitis, or they get, which is a viral infection of the liver. People also may shoot up and get impurities in their lung and get lung embolus or problems with lung infections. So all that's very common. lot of it is denial, and they rationalize all these areas in their life, their work life, their home life, their family life. They start neglecting things around their house, the world, their car. They may be high or not paying attention, damage their car. Not to mention the dental problems with opiates. A lot of people use opiates and they crave sugar because it amplifies the high. And so it dries your mouth out, and so you wind up getting a lot of cavities. Most opiate addicts destroy their teeth. Their teeth are all brown and black and rotten and cavities. They don't take care of it because if they get pain, they view it as an opportunity to get more opiates. So they don't take care of their oral hygiene. I've seen that virtually across the board. And they wind up getting a little overweight because they're consumed with eating sugar, not to mention the sugar causes coronary artery disease. So it's like this domino effect on their heart. Endocarditis from shooting up can possibly occur. It's all a rationalization, a denial about the opiate use. It hijacks dopamine. You use dopamine, it hits the mu opiate receptor, which is euphorogenic, meaning it makes you very high. And that high hijacks the reward system, so that's all you care about. You don't care about a good dinner. You don't care about your relationships. You don't care about your car, your teeth, your health. You just care about that high. And it's a single focus. There is a way out of this. And they live in fear of this withdrawal, this horrific withdrawal, because there's been points in their life where they have entered into withdrawal. Opiate withdrawal, goose flesh, hypersalivation, runny nose, flu-like symptoms, cramping, diarrhea, loss of appetite, generalized malaise, severe cravings, restless legs, legs shaking, tremor, sweating. A lot of people go into the fetal position in their bed and rock back and forth, rip the sheets off. Terms in the street are called jonesing. That can all be taken care of. One phone call to me, if you're out there. I use secondary meds. I clean the body out. Takes me 24 hours. I keep people totally comfortable by either using Clonidine or Fluoxetine to block opiate withdrawal. I use Baclofen to stop spasms. I use Promethazine to stop nausea, to help with anxiety. I use Lorazepam to stop with anxiety. I use loperamide to stop with the diarrhea. I use Quetiapine to stop with problems sleeping. And I manipulate these meds over the first 24 hours to keep someone comfortable, to clear the receptors from all opiates. The only opiate that doesn't respond to this is methadone, and that's a whole nother talk. It's a completely different detox. And once I have the receptors clear using these secondary medicines over the first 24 hours, I initiate phase 2 of the withdrawal with buprenorphine. Usually 8 milligrams is enough. And I use 8 milligrams 2 days, 4 milligrams 2 days, 2 milligrams 2 days or 3 days. That brings you off the opiate. Within 5 days, you're off. The good news is the body resets itself. This opiate receptor system is totally rejuvenated, unlike if you use Xanax or Clonidine or benzodiazepines, where that system takes years, 6 months, a year. The opiate system regenerates sometimes a week later, 2 weeks later. They say, I need a little bit more help. I'm having anxiety. I give them some Clonidine, maybe 2 or 4 milligrams of buprenorphine, just to calm them down. There's a small group of people that I detox that say, I'm craving too much. My system is not recalibrating. And they stay on buprenorphine for a few months, and then I take them off that. And then I use secondary meds to get them off buprenorphine. But everyone's different because everyone uses different amounts of opiates. Everyone uses opiates for different lengths of time. And everyone uses opiates differently in terms of how they get in their body. Shooting it, smoking it, snorting it, pill popping it. I've had people use rectal use of opiates, syrups. So everyone's gets into this for in different ways and uses it in different ways. So the detox has to be tailored to each individual person. You know, when I detox people, I give them my cell phone, and I'm on top of it every hour, whatever they need to get them off. And getting off is really not that hard. It's something I can do very easily. But in the mind of someone who's dependent, it seems impossible. But the way I look at it, it's extremely safe and it's extremely doable. You can, in order to get me to help you with the detox, just go to my website, drmarkagresti.com.